Hello everyone, this is Al, your Medicare Maniac, going over what do I pay for Part B covered services. This information I'm going to share with you today comes from the Medicare New Book 2020. This is the official U.S. government Medicare handbook. So please turn to page 29 with me. You got it? Page 29. What do I pay for Part B covered services? The alphabetical list on the following pages gives general information about what you pay if you have original Medicare and see doctors or other healthcare providers who accept assignment. You notice that's in blue. You can click on it and it'll pop up what does assignment mean. See page 53. You'll pay more if you see doctors or providers who don't accept assignment. Simply stated, if your doctor doesn't take Medicare, you're going to pay more. You're going to pay 100% out of your pocket. If you're in a Medicare Advantage plan or have other insurance like a Medigap policy, Medicaid, or employer or union coverage, your co-payments, co-insurance, or deductibles may be different. Under original Medicare, if the Part B deductible, $198 in 2020, applies, you must pay all costs up to the Medicare approved amount until you meet the yearly Part B deductible. Visit Medicare.gov later this fall to find out how much the 2020 Part B deductible will be. After your deductible is met, Medicare begins to pay its share, and you typically pay 20% of the Medicare approved amount of the service if the doctor or other healthcare provider accepts assignment. This next statement is very important. I put a little arrow in blue and it's in black bold. There's no yearly limit for what you pay out of pocket, meaning Medicare is an open basket. It's an open amount of what you can. So if you have an open heart surgery, you're going to pay 20% of whatever that amount is. There's no ceiling. There's no limit of what you can pay with just Medicare. Going on. You pay nothing for most covered preventive services if you get the services from a doctor or other qualified healthcare provider who accepts assignment. In other words, a doctor that accepts Medicare. However, for some preventative services, you may have to pay a deductible, co-insurance, or both. These costs may also apply if you get a preventive service in the same visit as a non-preventive service. The next box is very important. At the bottom of page 29, it states, Medicare Advantage plans have a yearly limit on your out-of-pocket costs for medical services. See page 59 to learn more and to find out what affects your Medicare Advantage plan costs. So let's turn to page 59. Everybody get your book. Turn to page 59. This is what it states. What do I pay? Your out-of-pocket costs in a Medicare Advantage plan depend on, first bullet, whether the plan charges a monthly premium. You pay this in addition to your Part B premium. Second bullet, whether the plan pays any of your monthly Medicare premiums. Some Medicare Advantage plans will help pay all or part of your Part B premium. This benefit is sometimes called a Medicare Part B premium reduction. Simply stated, some plans out there will give you so much towards your Medicare Part. They reimburse it, they put it back into your Social Security check. Third bullet, whether the plan has a yearly deductible or any additional deductibles for certain services. What do I pay? Next bullet. How much you pay for each visit or service, co-payments, or co-insurance. Medicare Advantage plans cannot charge more than original Medicare for certain services like chemotherapy, dialysis, and skilled nursing care. Next bullet. The type of healthcare services you need and how often you get them. Next. Whether you get services from a network provider or a provider that does not contract with the plan. If you go to a doctor, other healthcare provider facility, or supplier that does not belong to the plan's network for non-emergency or non-urgent care services, your services may not be covered, or your costs could be higher. In most cases, this applies to Medicare Advantage HMOs and PPOs. Simply stated that you have to use the network if you decide to join a Medicare Advantage plan. Whether you go to a doctor or supplier who accepts assignment, if you're in a PPO, private fee-for-service plan, or medical savings account plan, and you go out of network, see page 53 for more information about assignment. So what they're saying simply is, if you're in a PPO, or a private fee-for-service plan and you go out of network, you will still be seen, but you're going to pay a more expensive copay than as if you had stayed in network. Continuing on, whether the plan offers extra benefits in addition to original Medicare, and if you need to pay extra to get them. Extra benefits are referring to dental, vision, hearing, transportation, over the counter. That's what they're referring to. The plan's yearly limit on your out-of-pocket costs for all Part A and Part B medical services. Once you reach this limit, very important, once you reach this limit, you'll pay nothing for Part A and Part B covered services. And last but not least, whether you have Medicaid or get help from your state. Now let me break down some of the key terms. Assignment, an agreement by your doctor, provider, or supplier to be paid directly by Medicare to accept the payment amount Medicare approves for the service and not to bill you for any more than Medicare deductible and coinsurance. Coinsurance is an amount you may be required to pay as your share of the cost for services after you pay any deductibles. Coinsurance is usually a percentage, for example, 20%. Copayment, an amount you may be required to pay as your share of the cost for a medical service or supply, like a doctor's visit, hospital outpatient visit, or a prescription drug. A copayment is usually a set amount rather than a percentage. For example, you might pay $10 or $20 for a doctor's visit or prescription drug. Deductible, the amount you must pay for health care or prescriptions before original Medicare, your prescription drug plan, or other insurance begins to pay. Last but not least, Medicare approved amount. In original Medicare, this is the amount a doctor or supplier that accepts assignment can be paid. It may be less than the actual amount a doctor or supplier charges. Medicare pays part of this amount and you're responsible for the difference. Turning the page. And that concludes what do I pay for Part B covered services. I hope that answers all your questions. Thank you very much for your time and have a great day.